As the country moves beyond the 6-month mark in the fight against COVID-19, data analysis of cases, symptoms, recoveries, and deaths proving key to better understanding the virus's effect. Deputy Chief Medical Officer Dr. DeLon Brennan.
Rather than just looking at, we got this amount of tests that were reported today, are those tests based on what's happening right now? What were the specimen collection dates? How much symptomatology are we seeing out there? Are these people who are traveling? Are these people who are really ill? It's giving us a lot more idea as to what's going on with the disease. And that helps us to target our messaging to the public. It helps us to target what our supplies, equipment, our infrastructural needs actually are, what our human resource needs are. So the analytics definitely are getting us a much better picture of what's going on with COVID-19 in the Bahamas. And that can only be of a help to make sure that we can get things under a little better control.
Now, Dr. Brennan added that along with new data, indicators months ago suggested an expected increase in deaths during the now second wave of COVID-19.
We knew that with the spike in cases, with the rise in cases that was coming, that with our, not just with opening of our borders, but also with the movement of people and, not necessarily adhering to the measures that have been advised and put in place, we could predict that we were going to see a large number of cases that were going to come along, and we saw that. We knew that if we didn't implement, some of the more restrictive measures, the likelihood is that we would see increased numbers of hospitalizations and, unfortunately, more deaths.